China's economy and cultural influence continues to grow. The economy has grown on average by 9.4% every year since 2000. Disposable income has more than doubled over the past decade. It is estimated that by 2020, the middle class will represent 76% of China's urban population. By 2030, 80% of the population will be living in urban areas. But behind the expansion in population, wealth and urbanization, there are greater expectations and a growing need. A booming China has led to significant lifestyle changes, a reduction in physical activities, increased living and working pressures, higher rates of smoking and unhealthy diet choices. When these factors are combined with an aging population, where the proportion of elderly is projected to increase from 15% to 25% by 2050, the result is a healthcare system under pressure, struggling to respond to increased demands. Zhejiang province mirrors the growth, opportunities and healthcare challenges of the entire country. Non-communicable diseases are estimated to account for 87% of total deaths in China, with almost half due to cardiovascular disease, including heart attacks and strokes. Rehabilitation for 6 months after a stroke has shown to be most effective in comparison to other strategies. But this method is not viable for many due to the lack of facilities and appropriately skilled personnel. A further challenge is that many rehabilitation technologies are not yet practiced in China. Trauma-related mortality and injury have also been on the rise due to increasing rates of motorization and urbanization. China urgently needs the type of standardized integrated trauma care system which is found in other high-income countries. These systems, that include everything from pre-hospital to rehabilitation, have shown to significantly reduce the rate of death and disability from trauma. One study in 80 hospitals in eastern China showed that only 4.7% of the 15,611 inpatients with traumatic brain injury received vital early rehabilitation services. The need and demand for quality rehabilitation hospitals in urban and regional China is clear and immediate. The Zhejiang Medical and Health Group has identified this need and is rapidly developing infrastructure and facilities to bridge the gap between demand and supply. Zhejiang Medical and Health Group, with input from their Australian healthcare provider Aspen Medical, will operate a flagship rehabilitation hospital. The services and innovations will be market-leading in China and will bring the best from Australia, the United Kingdom and the world with regard to rehabilitation practice, technology and standards. Innovations in stroke treatment and injury rehabilitation, led by academics and industry experts, will ensure that this rehabilitation hospital is a beacon for healthcare in Zhejiang and a model for all of China.